All right, it is officially 2 o'clock, and since we respect your time, we're going to go ahead and get started. We thank you for everyone who is on with us. We're so excited to present about contraceptives today. But for the, I'm going to do an introduction of Mission West Virginia in case you're not, don't know anything about our company, but Mission West Virginia, we are leading a statewide effort to promote positive futures for all kids in West Virginia. We work with families as they navigate the foster care system. We also provide evidence-based life skills to help teens envision and create positive futures. And as a result of our work putting kids first in collaboration with social services, school districts, private foster care agencies, and other non-profits, the future is looking brighter for the West Virginia children. We have a couple programs within our company, and one is Frameworks, and that's the one that provides support for those interested in foster care or kinship care. We help you understand the system, we help you find a placement agency, and prepare to make a meaningful difference in the life of a child, and we help you through the certification process. If you are interested in fostering, you can call 1-866-call Mission West Virginia or 304-512-0555. Or if you just want to request a packet of information on our website, it's at www.missionwestvirginia.org/request/information. And you also can, before I go too far into this, if you want to turn on subtitles for our webinar, you can do that from your own computer. So if you have difficulty hearing us, it should put the subtitles at the bottom for you. The Think program, which Celine, our presenter today, represents, is teaching kids instead of nagging kids, teaching health instead of nagging kids. And the Think empowers teens to make positive life choices through education, life skills, and coaching. Our program is evidence-based, and it helps the students that we work with navigate the emotional pressures of all teens face as they develop, if you can remember that time in your life. This includes building healthy relationships, making healthy choices, especially around drugs and alcohol and pregnancy prevention. We deliver our program in partnership with schools in 20+ counties. We are vetted by district leaders, teachers, and other school leaders who are trained to work with kids. The program is evidence-based, as we said before, and it has shown to have a positive effect on preventing teen pregnancies, sexually transmitted or sexual risk behaviors. And our educators are very well trained on the most up-to-date information on trauma, sexual health, which is what Celine is going to speak on, and high-risk behaviors. Our management team does do on-site observations of our educators. We do that regularly to ensure fidelity is being followed. We also have federal pre and post surveys. We receive teacher feedback. We hold teen focus groups and site satisfaction surveys to make sure that, number one, every student is getting the same education, and number two, that we're doing a good job. And we know it also takes a whole community to help teens envision and create positive futures. So we also provide resources and trainings like this webinar and some in-person meetings to equip parents and families and any individual who supports kids as they navigate those lovely teen years. The workshops and trainings that we've had in the past include talking to youth about sensitive or hard subjects, hidden in plain sight, which is really good for parents and caregivers. It kind of shows you different ways, different items that adolescents are using to hide things that they might not want you to see. We also do trainings on trauma, sexual assault prevention and consent, teen dating violence, and much, much more. Your CEUs today will be offered for social work and nursing, and first choice services will be providing those. You must complete the evaluation link by May 27th, and that will either be posted in the chat box. You'll also get an email, and you'll get possibly an email reminder. And attendance will be cross-referenced with the Zoom attendance log. But if you want to take a screenshot of the QR code, and then all of those will go out for you. Today, we are excited to have one of our own presenting. It's Miss Selena Leiter, and she is a Think educator at Mission, West Virginia, providing evidence-based curriculum on healthy relationships. She received a BS in biological sciences and an MS in exercise science from Marshall University. Oops, sorry about that, Selena.
It's okay.
From Marshall, she holds a BS in natural, I have some, oh, okay, there we go. Now I can read it. In natural health, and is also a certified yoga instructor. She has worked in health and wellness prevention program implementation at the state and corporate levels. She has also taught healthcare and biological sciences at a local community college. She promotes healthy lifestyles, wellness, and disease prevention. And we are just so excited to have her today. So sit back, get comfortable, and be prepared to learn. So I'm going to give it to you, Selena. Oh, and if you have questions, please feel free to put them in the chat box or in the Q&A. And at the end, we will have time for those, and we'll bring those up and we'll discuss them with Selena. And if there's something afterwards, Selena has put her email contact information in the chat box, so that if you think, oh man, I wish I would have asked this, that you can follow up with her. So I will say, take it away, Miss Selena.
All right. Well, thank you. Thanks so much, Rita. I really appreciate you. Let me get my share screen on here. Okay. So I just want to first say hello and welcome to the contraception webinar, just on behalf of myself and Mission, West Virginia. We really appreciate that you registered and decided to attend the webinar. So I am just going to go ahead and get straight into the PowerPoint. So let me pull this up here in presentation mode here, if it will allow me. I have to escape for just a second. Let's see here. Sorry, guys, just a second.
I am really excited to see so many disciplines and so many different locations and agencies represented out there today, Selena.
Yeah, me too as well. This tab is covering up my slide view here, my slide screen. So I just want to be able to get it on the slide presentation view. Let's see here. Just bear with me for a second, please.
Go to home on your PowerPoint.
Yeah, if I could get to my slide.
Do slideshow there.
I'm trying. It's being covered up by the unfortunately by the video screen here.
Okay.
Hold on just a second.
Okay, you are muted, Selena. So if you'll unmute yourself, you are ready to roll.
Okay, there we go.
That's okay.
Okay, sorry about that. The one of the little technological control screens was covering up my slideshow and being able to start that from the beginning. So I apologize. I had to work out the kink there. So now we're ready to rock and roll. So again, if you're just joining, welcome. I thank you on behalf of myself and Mission, West Virginia. And we're just going to jump right into this, especially since we just had a couple of minutes of technological difficulty there. So you decided to show up today for the Contraception Options for Teens webinar. And again, as Rita had introduced me, my name is Selena Leiter, and I have a master's in science and a couple of bachelor's degrees, and also I'm a registered yoga teacher. So she had already pretty much talked about all of my education, and I just kind of recapped that there. So I have a degree in biological sciences. I've taught various healthcare and biological science classes at a local community college. but my master's in love is in exercise science and physiology. So I really, really like to just teach health and wellness, as you can see here from the presentation. You can just see that I've had several years of experience in the health and wellness industry. I've worked on program and development and implementation, excuse me, at the state and corporate levels, as Rita also alluded to at the intro. And I've just really worked hard in reducing disease in specific patient populations in the state of West Virginia. And that basically, you know, just overall, I promote healthy lifestyles and wellness and disease prevention, which basically led me to Mission, West Virginia. So I'm very honored to be with Mission. I've been here since January, and I really, really love everyone that I have the privilege to work with here. So just awesome, awesome, wonderful people and such a great organization. So as Rita mentioned, I am currently a Think Educator for Mission West Virginia, which I believe Rita had introduced that stands for, the acronym THINK stands for Teaching Health Instead of Nagging Kids, which is a teen pregnancy prevention program. So myself and my coworkers go into middle schools and high schools and teach curriculums on teen pregnancy prevention and building healthy relationships. So it's an awesome, wonderful program. So if you work with teens, advocate for teens, advise teens, this contraception webinar is really, really awesome and full of all kinds of wonderful information on contraception or birth control options. So these are basically the topics that we're going to cover. I know that it doesn't seem like a lot here just on this topic slide, but it is a lot of information, as you're going to see as we start to get into the presentation. So with the method options for teens, I'm going to cover the effectiveness of each of those options, the actual use of the method, along with associated side effects, and some precautions just to be aware of, along with costs, and then any additional medical information that's pertinent to that form of contraception. And then the other thing that we're really going to focus on is just obtaining free and low cost contraception, because most of us are native West Virginians. Well, I don't want to say most of us are native West Virginians, but we're all currently in West Virginia for the most part. And we know our population and how important it is to be able to obtain free and low cost options or forms of contraception in our area. So we're also gonna discuss that and hit that topic. So what we like to tell our youth as we're out educating them is that really the only methods that protect against sexually transmitted diseases and pregnancy. So you're going to see the acronym STD a lot, which most of us are familiar with. That means sexually transmitted disease. You know, a lot of times now in culture, you see STD and STI. So you'll see it used interchangeably with sexually transmitted infections. I think that we're moving more toward the term or the acronym STIs when we talk about that, but for the most part in this presentation, it will be presented as STDs for sexually transmitted disease. So we really try to drive home to our teens and our youth and adolescents just the really, you know, the real method that protects against sexually transmitted disease and pregnancy is the choice to not have sex or abstinence. So a lot of times I'll be with kids and they don't even know what the term abstinence means, but then we talk about, you know, we define that for them and just the choice to not have sex. If a youth is sexually active, of course, wearing a condom is also going to protect against sexually transmitted disease. Excuse me, I will apologize. I have been having some allergies, so I apologize for that. My voice might crack a little bit. So we really emphasize condom use as well if they are choosing to be sexually active. So, excuse me, I'm sorry. These are methods that protect against pregnancy. Of course, abstinence, or the choice to not have sex. Most of us are familiar with birth control pills. That's a very, very common form of contraception. Also the Nuva Ring, the patch, Nexplanon, which you've probably seen actually advertised on television, along with the Depo-Provera shot. IUDs are what are intrauterine devices. Excuse me, various foams and films and gels. Diaphragm, the withdrawal or pulling out method. We'll cover that and how teens should not rely on that method. Also condoms, of course, male and female condoms. A lot of times youth aren't even familiar with the fact that a female condom exists. There's also the sponge, and then of course emergency contraceptive, but hopefully that's, you know, not utilized very, very frequently, and we'll discuss about that when we get to that slide. So again, just to reiterate and drive home to the youth and adolescents with the methods of contraception, of course, the choice to not have sex or abstinence, again, is the only thing that's 100% effective, right? So, excuse me, I apologize so much. So if no semen enters the vagina, you know, there's no risk of pregnancy or any sexually transmitted disease occurring there. It's simple to use, right? Just choosing not to have sex. It also protects, again, like I mentioned, sexually transmitted disease. So if there's no blood, semen, vaginal fluids, as long as none of that stuff is exchanged and no genital touching, you know, there's absolutely no risk involved. So the cost is totally free, easy to use. So we really, really like to advocate this to our youth and teens, just to be sure that they're building healthy relationships and they're waiting with their choice to have sex, you know, whenever that time is appropriate for them. And each person is different, so we can't decide for them. But we do like to drive home abstinence, of course. Okay, so now we're just going to start talking about the methods that are, you know, 99 point, really over 99% effective. And these are some of these progestin only methods. And when I say progestin only methods, I just want to kind of talk for a couple of minutes or just a minute, just so you understand what I mean by that. So there are a couple of different hormones in the female body. And with our methods of contraception and birth control, of course, most of our options or methods are geared toward the female body. So when we talk about progestin only in the female body, there are a couple of primary sex hormones associated with the female body biologically. So one of those being estrogen, which is really the main sex hormone, and the second one being progesterone. So throughout a woman's monthly cycle, her menstrual cycle, it's really regulated by the dance and fluctuation of estrogen and progesterone that determines where the female is within her cycle. So progestin is actually a synthetic hormone. It's not a natural occurring hormone. It's a synthetic hormone used in birth control to prevent pregnancy. So we're first going to go over these really, really effective ones that are progestin only. So the first one is the Depo-Provera shot. Again, you can see 99% effective, as long as you get the shot as recommended. And this is just a shot of artificial hormones that are given by a healthcare provider. So this is really important. Again, if you're an advocate or an advisor to youth, you know, it's really important that we start to emphasize the importance of establishing primary care to be able to visit a healthcare provider and meet your healthcare needs. A lot of people clam up, especially youth, to talk to their healthcare providers. We're just learning our communication skills. So it's really good that the younger that they learn to communicate, the better, especially about their bodies and their healthcare options. So I always really like to advocate just establishing healthcare. Oh, thank you. So again, this is just a shot of artificial hormones given by a healthcare provider, and it stops the ovaries from releasing eggs. It lasts about 3 months. So an individual is going to need this shot, every 3 months. There are a few serious problems associated with it. It may cause weight gain, possibly moodiness, just because we're changing the hormones in the body. It also may cause irregular bleeding or eventually no bleeding. And we're going to see it. I don't have it on all the slides, but with most of these birth control methods, it can affect our menstruation. So it could cause spotty bleeding or irregular bleeding, or it can really change the cycle itself. So just be aware of that all of these options can, affect our menstruation itself. Cost here is about $35 to $75. But again, we're going to discuss that free or low cost options to be able to obtain some of these methods a little more easily in the community or by our healthcare providers. So the great thing about the shot is that depending on the individual and their level of responsibility, this could be a better long-term option. So somebody doesn't have to remember to take the pill every day at the same time. And we'll talk about that whenever we get to that slide. So again, this is the Depo-Provera shot and a Progestin Only method. And we're going to continue on with that with discussing the IUD. So the IUD is an intrauterine device. And as you can see in the little illustration down here in the right-hand corner, it's just a little T-shaped device that's inserted into the vagina and then past the cervix and is entered into the uterus or placed into the uterus. So you can see that there are several different brands. There's one that's called Paragard that actually contains copper that's really long lasting. So the good thing about an intrauterine device is that as you can see, just depending on the brand, it can last anywhere from 3 years to even 12 years. So it's a very, very long-term option for youth or for adolescents or for anyone looking for birth control method. So as you can see, again, that little T-shaped device, the copper one, the Paragard, the copper itself actually creates kind of a hostile environment for sperm. So the sperm can't survive just with the presence of the copper itself. So it destroys the sperm. So no sperm, no fertilization. So that's how the copper one works. The others that you see here, the Mirena, Kylena, those other brands that you see, they actually have a hormone that's released and prevents pregnancy. So again, this is a very, very effective form of birth control or contraception, 99% effective. It does have to be, of course, inserted by a healthcare provider. Again, the importance of establishing primary care. You can see from the illustration, again, there is a string that hangs down through the cervix. So if someone wanted to remove this, they don't want to remove it themselves. They most certainly want to go to the healthcare provider to get that removed. So it's really, really important that a healthcare provider removes this. And this is also wonderful for family planning, because if someone doesn't want to start a family now, but say, 7 years later, because this is so long lasting, you can just remove the IUD and, begin a family when you want to, whenever you're ready for that. So again, prevent sperm from fertilizing the egg because of the device. Cost is a little more significant here, $500 to $1,000, just because it is a device that needs to be inserted, right? We're talking about a medical device here. So that is the intrauterine device. This next one is Nexplanon. Again, another progestin only method. So this is, it basically looks like a little matchstick that is inserted under the arm, typically on the inside of the arm. And again, super effective. We have 99% effectiveness here. And again, it's just inserted by a healthcare provider, releases those artificial hormones into the bloodstream, stops the ovaries from releasing eggs. And this is another great long-term option because it can stay in place for 3 years. So, you know, these first three methods of contraception that we have talked about are really good for long-term choices or options. And again, you know, each person is individual, depending again on their responsibility. These can be great options for people. So again, we may see a change in the menstruation itself, and again, a little bit higher cost just because of it being an actual medical device that stays in place for years on hand. So now we're going to talk about birth control pills, which is very, very common. These are, of course, hormone doses that we take. And the mini pill, I'm going to start with the mini pill first, just because it is also a progestin only. So it contains no estrogen. So the mini pill is also just, you know, progestin only. And we're going to start to see the effectiveness decrease now. And this is just basically, you know, due to human error, because leave it to humans, you know, we can always find a way to make mistakes. And that's just kind of our nature. So we're going to start to see the effectiveness decrease a little bit just because of human error. So this will prevent ovaries from releasing an egg. And it also actually increases the mucus in the vagina that makes it harder for the sperm to swim through as well to reach the egg. So it does a couple of different things here. The thing about birth control pills is that it really takes someone responsible who can take the pill every day, even down to the same time every day, because I know with the mini pill that even a 2-hour window, if you miss your time, you need to be sure that you're backing up that form of birth control. And if someone's on a birth control pill anyways, we really advocate to our youth, you know, that birth control pills is just for pregnancy prevention. They're not covering the safety of protecting yourself from sexually transmitted disease. So you also need to be using a barrier method to protect yourself from sexually transmitted disease. So birth control pills in conjunction with typically a condom or some type of barrier method is going to be most ideal to prevent pregnancy and also prevent transmission of disease. So like I was saying, you know, if someone forgets to take that pill, you know, you really, really want to back that up. And it's also good to be very aware that if someone gets an infection and gets prescribed an antibiotic, this can decrease the effectiveness of the birth control pill. So again, really, really important to use that barrier method. You know, if you're taking antibiotics while you're on the birth control pill, just to keep yourself safe. And you can see that there are several brands of birth control pills for the mini pill. And the cost is less, of course, than some of those devices that we just discussed, whereas the cost is about $15 to $50. And then the pill combination, I'm just kind of flipping it over to the opposite column, or the first column that you would typically hit first. This one contains both estrogen and progestin. Effectiveness is exactly the same, about 91%, and you might see some differences in effective percentages. You might see it in the 88%. And whenever we talk about percentages, we're just talking about out of 100 women, you know, how many women would become pregnant out of 100 in a year. Okay, so if you look at 91% effective, as we have on the screen here, you're talking about 9 women out of 100 women who would become pregnant, you know, taking the pill in that year. So that's what we mean when we're actually looking at the percentages of effectiveness, just so you're aware of that. So again, this is that combination. Same thing, prevents ovaries from releasing an egg. Again, super important. You're taking it, you know, every day, at the same time of day, and they're laid out sometimes in a circular or dial fashion, or sometimes in a week, like a calendar. And typically when someone menstruates, especially with the pill combination, you're not actually getting a dose of the hormone, you're actually getting a sugar pill, but it just keeps the youth or the individual, you know, used to taking the pill every day so they can stay on track. Same thing with antibiotics, you know, can decrease the effectiveness. Very, very important that we are protecting ourselves and using those barrier methods all times when we're talking to youth. Some people are in long-term committed relationships, but we always want to advocate using that barrier method as well. So you can see also several brands here with the combination pill. Again, costs $15 to $50. So now we're going to continue on the combined hormone method, where they combine that estrogen and progestin. So you probably have heard of this or seen this advertised as well. It's called the patch. Same effectiveness level at the birth control pill, 91% effective. The hormones are absorbed through the skin. Same thing, stopping ovaries from releasing eggs. The thing about the patch is that you change the patch weekly for 3 weeks. And on that 4th week, you'll have your period. So you won't wear a patch that 4th week. You'll wear it, you know, when someone is menstruating. So you'll just change the patch weekly, or change the patch, excuse me, weekly for 3 weeks. And then you won't wear one. And then after you, you know, once you're done menstruating, you will put another patch on. So, you know, if you've seen any kind of these medication type patches, people wear them in different locations on the body, the thigh, the stomach, buttocks, upper back, or arm. The one thing that I can say about the patch is that it's good to change the spot up where you wear that, because sometimes people will experience skin irritation if they put that patch in the same spot. So you want to make sure that you're rotating that patch out just to avoid any kind of skin irritation. So whenever I researched this one, I found that one box, of course, for a month, or those 3 patches, run about $35 to $50. So that is the patch. This is the Nuva Ring. Again, everyone's probably seen this advertised. Our society is very good at advertising birth control or contraception methods. So we've probably all seen this stuff advertised on TV to us. You can see it's just a small flexible ring. Again, in the illustration down here, you can just pinch it together. Again, we're still looking at about that 91% level of effectiveness. And this is just inserted into the vagina, again, for 3 weeks. And then again, removed or taken out for the 4th week during menstruation. So you'll typically have your period that 4th week. And we're going to start talking about some methods that really require a certain level of comfort with your body, just for use purposes. So just to be able to insert, and to remove the method of contraception. So this ring just releases synthetic hormones. Cost, again, kind of like the birth control pills, about $15 to $50 for the ring. So we're going to keep on with other contraceptive methods. I'm going to talk about the sponge first, just before we get into the spermicide. As you can see, we're going to continue to decrease our level of effectiveness. So the sponge is about 88% effective. The thing about the sponge, everything else that we've discussed up to the sponge requires a prescription, right? It requires that establishment with a healthcare provider. The sponge, you don't need a prescription. You can basically just walk into a pharmacy and you can buy the product. So you don't need a prescription for this. Again, it requires that level of comfort with your body. So it's inserted deep into the vagina before sex. It's basically shaped like a circle. I wish I had a picture of it to show you here. but it's shaped like a circle and it has a little indentation in it to put the spermicide in that's on the other column here on this slide. So you can use this in conjunction with a spermicide just to, help improve the effectiveness of the product. So it's going to cover the cervix and block the sperm from entering the uterus. It needs to be wet with clean water, and you just fold it and then you slide it back into the vagina as far as your fingers basically can reach. So you can imagine or see why that comfort level is so important with some of these products. And the really neat thing about some of these forms is that they can be inserted, hours before intercourse. So this can actually be inserted up to 24 hours, but it has to be left in place at least 6 hours after sex. And a package of 3 of the sponges run about $9 to $15. And like I said, you really want to use the sponge in conjunction with the spermicide. And spermicide can come in multiple forms. It can come in foams, films, even a suppository, a gel. So there are several options of different types of spermicide available. If someone were not to combine this with other products and just use the spermicide alone, you can see again the decrease in effectiveness, right? So it just continues to decrease and drop. So a spermicide used just by itself is about 72% effective. Again, just due to that human error. Like I said, we are human and it's our nature, and it takes education and, being comfortable with the product to use it 100% properly. So again, spermicide, you can just buy it in a pharmacy. You don't need a prescription, and it's just made of chemicals that actually kill sperm. So it just disables the sperm. Again, you can put this in before intercourse. Again, it's very, very easy to use, but it can be messy. And like I said, it's safer to use in conjunction, not just with a latex condom, but also other products. But a lot of people do use spermicide along with latex condoms. And a lot of times condoms now actually already come with spermicide. So cost of spermicide is relatively inexpensive, as you can see there at $8. So just continuing on, the diaphragm is something that needs to be fitted by a healthcare provider. So again, it's really important that we go to a healthcare provider for some of these options of contraception. It has to be fitted by a healthcare provider to be sure that it fits over the cervix properly. So it's just something that's flexible, again, that you can, pinch together and you can insert into the vagina. And again, it needs to fit tightly over the cervix. So that's why it's so important to get fitted. Again, 88% effectiveness here. And this is also really good to use in conjunction with that spermicide that we just talked about. So the more that we incorporate, the less likely it is that fertilization will occur. So again, this is something that can be put in hours before having sex. And also, again, it's something that needs to be left in place 6 hours after intercourse. Again, it can be messy and it can be a little bit irritating depending on the person. So that's something to be aware of too, is if someone has some kind of a reaction to some of these forms of contraception. And sometimes, unfortunately, it just takes experimentation to know how your body is going to react to some of these methods. So cost is about $15 to $75 for the diaphragm. So that covers several forms of contraception. The next one, which we're probably all aware of, excuse me, or have heard of, is the withdrawal or pulling out method. So we caution our youth, I really emphasize this with the youth that I work with, not to rely on the withdrawal or pulling out method. And you can see why, of course. 27 out of 100 women whose partner used this method becomes pregnant. So, this is just not a method of contraception that we want adolescents to rely on. And this is why education is so important. The more they know, the more empowered that they are to make healthy choices for themselves. So withdrawal is something that is totally unreliable because pre-ejaculate is always present. Okay, so it's just not recommended. So of course the cost is free there, we see, but is it really whenever you're looking at the statistics of 27 out of every 100 women becoming pregnant in a year? And I've heard that couples who are having sex on an average basis, which I think is about, once a week, most couples will become pregnant within that first year if they're just relying on this method alone. So this is really, really good. Again, if you're working with youth and teens and you're an advocate or an advisor to, educate your teens and make sure that they are aware that they cannot rely on this method. So condoms is one of our most a really familiar or very popular form of contraception. Of course, this is the one that's really geared more towards male. So everything else I've talked about has really been female focused. So this is, one of those forms of contraception that are marketed toward the male population. So whenever we look at male and female condoms, you can see that we have an effectiveness of 82%, again, just due to human error. Yeah, if we're using them perfectly all the time, the effectiveness goes up highly, but especially when we're young and, we're not familiar or we don't have enough experience. So we see that effectiveness level, really decrease just because of human error. So we know how, typically as adults, we know how condoms are used. It fits over the erect penis and catches the sperm. There are different types of condoms, especially when we're talking about the male condom. There's latex. There are other synthetic rubbers like polyurethane. There's also lambskin, but we caution folks to avoid lambskin, especially with sexually transmitted diseases, because it's just made from another animal skin and disease can penetrate through that and it doesn't protect people. So really latex condoms are the best to protect against sexually transmitted disease. These are things that can be bought in a drugstore. I remember when I was observing a coworker, I thought it was funny because one of the students was like, you can even buy that on Amazon.com. So I thought that was funny because we're all such online purchasers anymore. It was funny to hear a student say, hey, you can buy that on Amazon.com. So you can literally buy condoms anywhere. You can be a minor. You don't need parental consent to go in and buy condoms. So they're really easy to use as long as they're educated on the do's and don'ts of condom use. There are mistakes that people make, and we like to educate our youth on the do's and don'ts of proper use. And a lot of people don't even realize that they expire. So it's good to be aware that there's an expiration date and proper use of condoms to increase that effectiveness. So this is that one, if you recall, to one of the first slides in the presentation, that helps prevent, again, sexually transmitted disease and pregnancy. And the price will vary per brand and count. There's all kinds of brands out there. So typically a box of 36 goes for about $15. So there are a female condom too that can be purchased in drugstores. It's basically a pouch that's inserted into the vagina before intercourse. It's a little trickier to use, to be real honest, because it has to be held in place. It can shift if it's not properly held in place, and the effectiveness will decrease, of course. So the female condom does also help prevent against sexually transmitted disease and pregnancy. However, the male condom is much more popular. So you can see that a box or a 6-count goes for about $15 there. And again, prices vary per brand and count. So the condom, of course, is a barrier method, and that's really important. Also the diaphragm. So it's good to be aware of barrier methods. And I'm going to play a short little film at the end of the presentation, just so you can see actually the types of different methods. So when we talk about barrier methods, condoms is one of those, along with the diaphragm. And then this next slide, right, the dental dam is also a barrier, because it's really important that our youth is aware that barrier methods are really important for not just kind of traditional vaginal sex, but also for oral sex. So we want to make sure that people are protected in any type of sex that they engage in, whether it's vaginal, anal, or oral. And a lot of times we get questions about sexually transmitted disease in relation to oral sex. So it's so important that our youth understands how to protect themselves engaging in oral sex. So there's something called a dental dam, which is just basically a little sheet or a square of latex rubber or polyurethane that's used between the mouth and the genitals or anus during oral sex. So this is just used to prevent the transmission of sexually transmitted disease, because it can be, of course, transmitted through oral sex. Again, you always want to be checking the expiration date of these things, and you never want to flip over or reuse it just like a condom, right? It seems like common sense, but we put it in here for reasons, because again, leave it to people and people will try just about anything. So we just want to make sure that everyone's educated properly. Cost is pretty inexpensive. You can get 5 of these for $7. So we've already pretty much talked about condoms, but also condoms can be used for oral sex. So it's important that you can use a condom and whenever engaging in oral sex to, again, prevent the transmission of sexually transmitted diseases. This also can be used to create a dental dam if you're creative, and you can just cut the tip off and cut off one side, and you can just lay that flat too. So now we're going to move in. We've pretty much wrapped up the methods, most of the methods of contraception. And now we're going to kind of switch gears a little bit and discuss how to obtain free or low-cost contraception methods under family planning. So again, like I said, just with our population and where we are, in the country, unfortunately, there's a lot of impoverished areas. So I really, really love the fact that we have Title X clinics that receive funding for family planning, not just for all people, but for our youth and adolescents to be able to take advantage of. So anyone can be eligible if they're a student, if they're a youth or an adolescent. And services don't just have to include free or low cost contraceptive. It can also include things like breast exams, screening and treatment for sexually transmitted disease, pap smears, pelvic exams, pregnancy testing. So just a very, very valuable resource for people to utilize in the community. So the great thing about Title X clinics or family planning is that you can receive free or low cost contraception, which is what we've been talking about. So all of these things that you see listed, which is pretty much everything that I have discussed up to this point, is covered there. We haven't discovered much about emergency contraception. We will here in just a few more slides. We'll talk about emergency contraception. And I really haven't touched on surgical sterilization, because for youth or adolescents, they're still young, and they still have their whole lives ahead of them and time to decide if they want to have families or not. But these are just to be aware, surgical sterilization is also something that someone could obtain at a Title X clinic or under family planning. And they're also a great resource just for all kinds of information doing, just in association to sexuality and your sexual health. And again, another great place to establish primary care, for providing health care. So this is just to show you Just some information for consent, just according to West Virginia law for healthcare for minors, for our youth. So teens don't need parental consent to be tested for sexually transmitted disease. And that is something that a family planning is a service that a family planning clinic can provide. Excuse me. So the CDC recommends that sexually active teens be tested twice a year or once every 6 months. Definitely if they're involved with more than one partner or their partners change, really important to be tested. Again, like I mentioned when we discussed condoms, teens of any age can purchase condoms from a store or online. So, they don't need parental consent. Also, a teen can obtain a prescription for birth control without a parent's permission if they're married or if they go to a Title X clinic or family planning clinic, or they can demonstrate maturity. And if someone, is mature enough to decide to have sex, they're probably mature enough to, receive some form of contraception through a clinic. So just continuing on, just like we talked about condoms, teens of any age can purchase a pregnancy test from a store or online. You can see the cost here is between $8 to $15 for a pregnancy test. They can also take a confidential test at a family planning or a Title X clinic for free or for a reduced fee. Now we're going to talk a little bit about emergency contraception. They contain a progestin only hormone, levonorgestrel, which can be purchased without a prescription and without showing an ID. So there are a lot of over-the-counter brands, including Plan B, Take Action, Next Choice, One Dose. There are several different options in a pharmacy for emergency contraception. It is really important, though, that someone does not utilize emergency contraception as a regular form of birth control. At worst case scenario, someone makes a mistake and they run out to buy this, and hopefully it gives them enough of a scare tactic or a scare to, not want to do this again, right? Maybe think about other contraception options. So it's really important that people don't utilize, this form of contraception on the regular for their birth control. It does delay or inhibit ovulation. You can see it's pretty affordable, maybe not so much for a teen, but it is about $50. You can see $35 to $50 for emergency contraception. Important to note that it can be less effective for women who are over 170 or 165 pounds. You don't want to take any extra pills. You don't want to mix different pills of emergency contraception. If someone experiences nausea and headache, that can be a side effect. But if you actually vomit within an hour of taking it, you definitely would want to call your healthcare provider. Your menstruation or your period should start within a month if you do need to take one of these forms of contraception. So if you don't get your period by the time you expect it, you may need to get a pregnancy test. So it's just a little bit of information on emergency contraception. So these are just some summary sheets of everything that we've talked about. You can see that on the left-hand side of the screen, it shows the effectiveness. And then on the right-hand side of the screen, you can see, how many pregnancies per 100 women in a year. So kind of how we've been discussing effectiveness percentage-wise, you can see that on the right hand of the screen. So you can see that top line, right? More of those devices, how effective they are. And then just based on those other forms of contraception, how the effectiveness decreases. So we actually do have these as a resource. They're really nice and colorful. So if you're interested, if you're an advocate, or you would want to post some of these, feel free to email me and I can send you some of these. So just so you have the information to post if you would be interested. I have another summary sheet. It's pretty much the same thing, but it shows the emergency contraception on the right-hand side. So very similar to the previous flyer, but it just includes the emergency contraception information, which you can see it can vary from 58 to 95% with the single-use emergency contraception. And then this is another nice little flyer that we have that shows all these different methods. It shows the risk for pregnancy, shows other side effects, how it can affect the menstruation. So this is also a very, very nice summary sheet that you could post if you're working with youth or adolescents somewhere. So like I said, I'm very, very happy to supply these to you if you would be interested in a copy of them. So now I'm just going to pull up a little video that just kind of summarizes it. It's just about a 4-minute video, and that should pretty much wrap up the presentation.
There are 3 simple changes I tell all of my friends.
Let's try to skip the ad here if we can. Apologies for that, but it's a pretty good little video.
Okay, we're not seeing the YouTube, so I don't know if you've shared it yet. So
Oh, what is it?
we're not seeing it.
Oh, you're not seeing it? Oh, hold on. Let's see if we can get it. Let's see. Oh.
Maybe copy and paste the link to YouTube itself and then screen share YouTube.
Okay, let's see here.
We had trouble with that last presentation.
Okay, let's see if I can get out of here. Oh, shucks. Well. Give me just a second. Hopefully I can share this with you.
If not, if you would copy and paste and just put the link down in the chat box.
Yeah, I think that's what we'll do. We'll just copy and paste it because it's just a nice little summary. And then if you're interested in watching that, you have the availability too. So let me
send that out. Appropriate for teens also, Selena?
Oh, yes, yes, it sure is. Yep, it's a really, really great summary. So yeah, it's appropriate for teens as well, for sure.
Okay, Selena, I'll send that link out in the follow-up email to everyone as well.
Okay, that sounds perfect. I appreciate that, Becky. Thank you. Okay, so I just want to let you guys know this is another resource that you can share with youth and adolescents. And this is, oops, sorry about that. Oh, this is our mobile app. We have a Mission West Virginia Think app. So the QR code is here, and it can also be searched up, of course, on Google Play or the App Store. But we just have a Mission West Virginia Think app that we promote to youth and adolescents because it's just such an amazing resource, not only for adolescents, but also for parents. There's about any resource that you could possibly imagine that teens may face, anywhere from bullying to contraception, to sexual identity, on health. So there's just so many resources available through this app. And the really neat thing is that there's a feature that they could directly message an educator, any questions that they have. So a fantastic resource to, advocate or pass along to adolescents or youth. So I just want you all to be aware of the Mission West Virginia Think app. I apologize that there's something over the West Virginia Think there, but a great resource to pass along. So this is just a time where just curious if anyone has any questions. So if you have any questions, it's been a minute over an hour, so let's just see if anyone has any questions, and if I can answer those, I'm happy to.
We do have a couple questions that came up during the presentation, and then if anybody else has one, they can just unmute and chime in. The first one was Nancy Lowe was asking, are there stipulations on sterilization?
You know, that is actually a fantastic question. And I will be real honest with you. I do not know that answer off the top of my head.
Okay.
So if we can get her information, that really is a fabulous question and something that I have not thought about.
Okay,
So
if you want to, we can get the answer and just send it out to everybody.
I think that that would be great because you know, I'm going to be honest with you. I don't know the answers to all questions, and that is not one that I'm familiar with the answer.
Yeah, Jamie Masters put in there contact family planning.
Yeah, that's a great suggestion as well.
And we also had another comment. I don't know that as much as a question, but when you were talking about contraceptive pills, that it's not talked a lot about that you have to take them basically the same time every single day.
Yeah.
And that's something that's real. I think those were the mini pills, maybe.
The mini pill especially, and I'll be personal with you, I will share this from personal experience. The reason why some people are prescribed the mini pill, and I happen to be one of those, is because I have migraine headaches with auras, and I also have a clotting issue. So I can't take estrogen. So certain populations cannot take, you know, some hormones. So that's the mini pill. And it's down to a 2-hour window. If you miss that 2-hour window, you need to be extremely cautious and make sure that you're backing that up, because it will not be as effective. So yeah, we don't hear that enough. And I think that this is why these kind of webinars and forums are so important, because it really, it can be a timing thing. So it's really important to take them as close.
I think another thing we don't hear a lot about too is, I know I was on antibiotics a lot when I was young and newly married, and no one ever told me that it reduced the effectiveness of my birth control pills.
Yeah, it
And
is.
we tell our students that, and they look at us like, really? It's like, so that's another thing that, you know, we as you guys out there that are on the webinar as providers and talking to youth about this, you know, make sure that they know those two things, because sometimes the medical facilities or the doctors get a little, you know, they have so many things on their mind, they forget to tell them those very important little details.
And that is so true. I'm so glad that you brought that point up, because often we go to our doctors and rely on our health care, but they don't educate us as much as, you know, we don't get all those little details. We don't, we still leave the doctor's offices with a lot of questions. And that's where health coaching and, you know, organizations like Mission West Virginia come into play and can be so helpful with that additional education.
Well, Patty McGrew in chat made a good point. Teens may not ask those questions with parents in the room. And teens also, we need to educate them that they are allowed to ask for their parents not to be back there with them.
Absolutely. And my children's healthcare provider actually asks me to step out. So if you are a parent of a teen, you may have experienced where a physician will ask you to step out. Not only are they asking those questions maybe about abuse, but they're also, you know, that allows the adolescent to maybe voice you know, their sexual habits without being in the presence of their parent, if they're afraid that their parent may judge them or feel that they don't have that open communication with their parent. So absolutely.
And Jeannie Brenneman came up, had a good point that she found out a lot from her pharmacist. And as the mother of a pharmacist, I will tell you, they laughingly say they took 8 semesters in college of just pharmaceuticals, and doctors took 1. So if you do have questions about how any medicines, even in your personal life, react with some other medicines or anything, they are a good resource also. And you're not going to ask them anything they haven't heard before. So thank you, Jeannie, for bringing that up.
Yeah, absolutely. That is also a great point. We have so many other wonderful resources in our community that we can utilize and that we should be aware of to utilize. So, yep, absolutely.
All right. Any more comments or questions? Okay, we want to be mindful of your time. We once again thank you so much for participating. We hope you have learned something. And also be sure and fill out the link for the survey. You will be getting an email, and Selena will get back to you with the answer to the question about the sterilization. Thank you all.
Absolutely.
You have a wonderful one. Thank you, Selena. You did a great job.
Hey, I just wanted to say thank you again so much, and logical difficulty and my voice. Unfortunately, my allergies had to flare up on me. So I apologize at the beginning for the little bit of the rough start, but thank you so much. I appreciate you all.
Getting lots of thank yous for the training in the chat box. Have a great afternoon, everyone.